name is Cal Maurice Will. I was born with asthma, and I was buying Primatine mist over the counter at the drugstore. Well, they stopped selling it, and I had to get them inhalers. So they had like a substitute inhaler thing now. It's more like a nebulizer, but it run off battery. Well, then I had to get the medicine go in it. So the doctor that I was seeing, he wasn't giving it to me. So that's when I heard about the free clinic. They do a lot for me. I get to see the doctor. They give me my medicine. For the Alabama Free Clinic, I would go to the emergency room. Yeah, I'm a lot better now.
It's somewhat strange, but we have many people on very expensive pharmaceuticals. And the expensive pharmaceuticals directly from the pharmaceutical manufacturers allows us to give a high level of pharmaceutical support at no cost to the patient. Baldwin County is the fastest growing county in the state of Alabama. With that growth in population comes a growth in the population that we serve. And really to serve these people and to give them the care they need, we really need more support.
My name is Laurie Kittrell. I am the Executive Director for Alabama Free Clinic. I began working in the medical field when I was really young. My first job was when I was 18 years old at a private physician's office, and then went on with pharmaceutical companies and ended up majority of my career at the hospital. I would see patients come in through the hospital and see that they were in some dire need, very sick and uninsured, and realized that there was a medical need that was not being taken seriously. There was a gap there. So I found out of a place called Alabama Free Clinic, and I started volunteering there. Boy, my heart just became filled, and just started working there and ended up being a staff nurse and clinic coordinator, and then in 2009, the board of directors voted me in as the executive director.
I'm Harvey McCullough, a local family physician in Baldwin County. I'm involved with the Alabama Free Clinic because I am a physician and I see lots of needs, medical needs in this community that need to be met. Particularly with patients who cannot afford to go to the doctor or don't have the means to go to the doctor, lack of insurance, for example, but yet they have real needs, and I can help in a small way alleviate some of those needs. I think that's a calling of a physician, particularly when you find yourself in a community that has such needs. So that is one of the reasons I think the clinic provides quality care, excellent care. We have a large base of people who need us, and we need to expand what we're doing so we can more effectively reach the large numbers of people who need us. In spite of the government programs, in spite of Medicaid, a lot of folks don't realize there are a lot of folks who fall between the cracks that aren't getting the things they need at all. At the Free Clinic currently, we work with patients who have hypertension, hyperlipidemia, asthma, COPD, coronary artery disease, diabetes, osteoarthritis, common medical problems, what I call the bread and butter of medicine. We provide free labs, we provide free care, totally free care. We provide follow-up and continuity. We do not provide controlled substances. We don't do procedures, we don't do emergency care. But rendering what I've just listed that we do, we can actually prevent a lot of downstream medical costs for our hospitals, for the emergency room, for society in general, and a lot of suffering that's needless if we address problems before they get large. A lot of these patients haven't had the primary care that they need, and then their problems escalate into big emergencies and expensive things that happen in local emergency rooms and hospitals. I think the quality of the care that is received in this place, the Free Clinic of Baldwin County, is excellent. We don't cut down on the quality just because it's a free clinic. The labs that I do, for example, there in patients are the same as the labs I do right here in my office. The medicines I prescribe are the same. The concepts that we use are the same. And so we strive to have excellent care in that setting, and that's what we expect of ourselves, and I think it's being delivered there too.
I first found out about the Alabama Free Clinic through a patient of mine who felt pretty strongly about his volunteer work with them. Shortly thereafter, I was introduced to Lori Kittrell and learned more about the mission and the management of the AFC. It didn't take me long to decide it was something I wanted to be a part of. Over the last decade, a lot of focus has been put into the correlation between oral health and overall health. A lot of research done on how oral health is associated with diabetes and heart disease and the risk factors involved there. Still lots of things ongoing with periodontal disease and tooth decay. The inflammation that's involved in those things or associated with those things, no doubt plays a role in overall health of the body. I've been somewhat where these folks are. There's been a time that didn't have health insurance, didn't have dental insurance, and if I'd had something happen major, I would not have had the resources myself to be able to take care of those things, and would have had to totally rely on an entity like the Alabama Free Clinic. And it certainly, if it's not there, then those people are left out. So I have a lot of heart in the mission of the Alabama Free Clinic and how I can be involved in helping people that would otherwise not receive this care.
I go to the free clinic because I'm an insulin-dependent diabetic, type 1. They give me emotional support. They give me support through my medicine. They give me counseling. It's just a great place for someone with no insurance to be. I work for Walmart 40 hours a week. They do offer insurance, but the medicine I need is not covered. You pay out of pocket for it otherwise. I need the free clinic to stay alive. Thanks to my interactions with Dr. Menifee at the free clinic, over the years I have changed my diet. I've quit smoking, I've quit drinking. I exercise on a regular basis. I feel like a totally different person, and it wouldn't be possible without Dr. Menifee and the free clinic.
We moved here to Daphne in 2003, and I think it was shortly after that Bill Getter asked me to volunteer at the Alabama Free Clinic. And so I've probably been doing it for 10 or 12 years, I think. When I started, it was just once every 3 or 4 months. But over the last several years, because of the need, I now do it every month. We have a clinic for people with diabetes. Because the number of people in Baldwin County with diabetes who have no health insurance is rapidly increasing. Just to give you some brief statistics on diabetes, it's the only chronic disease that's increasing in frequency. Heart disease is going down, cancer is going down, but if you look at the statistics over the last 20 years, the prevalence of diabetes is increasing exponentially almost. When I moved to Alabama 25 years ago, I think 2% of the population had diabetes. Now, in Alabama, 15% of the population has diabetes, and it's increasing. When you look at the number of people who are uninsured, it's kind of a sobering statistic because approximately 15% of the people in Baldwin County have no health insurance, no Medicare, no Medicaid, no private insurance. If you look at those 14,000 to 15,000 people with diabetes, and that 15% of those have no health insurance, we've got 2,000 or 3,000 people living in Baldwin County who do not have health insurance. If you have diabetes and no health insurance, you're in trouble. The reason for that is the cost of diabetes is just staggering. When you look at the cost of doctor's visits, the cost of laboratory testing, the cost of glucose monitoring equipment, and especially the cost of medications, even if you have health insurance, the cost is a daunting task. Imagine what it's like if you have no health insurance. Any new medicine that comes out for diabetes, and there are lots of new good medicines that have come out, price per month is anywhere between $400 and $600. If you don't have health insurance, how are you going to pay for this? Well, that's where we're able to help through the Alabama Free Clinic. Those people who work but are not able to have health insurance, we provide them with their doctor's visits. We do all their laboratory testing. Yeah, one of the things we thought was that with the Affordable Care Act, we thought that the need for the Alabama Free Clinic would go down, but unfortunately, we're seeing the need increasing. It's because of the number of people with diabetes. We see more people every month than we did the month before, and so the need is significant, and it's an area where I really feel like we're able to help those who need the help.
I've been with the Alabama Free Clinic for about 7 years. I enjoy working with the folks, and the clients are wonderful.
I've been with Alabama Free Clinic for a year. I retired in 2016 and started volunteering after that. And as a former hospital nurse, I saw patients come to the hospital that did not have insurance, and they would come in and would get their disease managed, but then we'd send them home with no medicines and no doctors to follow up with. And that's something the Free Clinic, Alabama Free Clinic, is able to provide. Is we have physicians that can manage their medicine, and hopefully we can keep them out of the hospital and working in their jobs so they're productive.
When I first started at the Free Clinic, I was in my wheelchair. At that time, I was desperately for help for my meds. I called them in Bay Minette. They set me on an appointment up, and they scheduled me closer to me, which was a great help for the gases, to go to Robertsdale. And I've been going there now over this span of time, and every day it gets a little better, because it had been 7 years since I had my eyes checked. They had me to get my eyes checked and glasses. Also, in this time span, they sends me to the dentist there in Robertsdale as well. No, I go to Loxley to Dr. Willer's, and they clean my teeth and check me for any kind of dental work that I need. And all of this have come past in these 7 years.
I'm John Wade Thurl with Level Investment Management, and I'm a board member of the Alabama Free Clinic. As a board member of the Free Clinic, we see a lot of patients that come in and give their testimonials. And what's surprising is a lot of these people are working 2 or 3 jobs and 40, 50 hours a week, but they don't make enough to provide for their own health care coverage. So it's exciting to help someone who's helping themselves. They're working hard, and we can come in and give them a little bit of assistance, and they're able to provide for themselves and their families. Despite being very mindful of what we're spending as a clinic, there are things that we have to fundraise for. Doctors are donating time, pharmaceuticals are donating medicines, but there is an expense sooner or later. There are supplies that we need funds for. So community donors are very important to what we're doing on a day-to-day basis, and we need to continue to expand those if we're going to continue to see more and more patients. It feels good to help someone out when they're working hard for themselves.
This is our 20th year of operation, thanks to the generosity of the community that supports us. We now really have a very defined goal in this community. We're working cooperatively with the major hospitals in the county. They provide us services, and we provide them services. And it turns out to be a really very natural harmony between the two. Yeah, and when we give our therapies, which are primarily preventative therapies, and you're preventing a heart attack or stroke, you're keeping people out of the emergency room where the care is expensive and is not comprehensive. And you're also keeping people in the workforce, and you're also keeping people with their families, and you're also really helping the financial integrity of the whole community. A working person, even working for minimum wage, is paying taxes, supporting their family, and if we can provide their health care and keep them working and as a member of the community and their family, we feel very privileged to have that opportunity.